Thanks for having me this afternoon. I appreciate it. Like you said, I'm Nick Rohlfs. I'm a chiropractor at Beacon Orthopedics. I know it says Rohlfs Chiropractic Care. We are within Beacon Orthopedics. So we've been there for about 28 years. My dad's a chiropractor as well. So I joined with him about 8 years ago when I graduated school. I'm from Cincinnati, born and raised. I went to Moeller High School, went down to University of Cincinnati. I played baseball at UC, and then throughout my time at UC, I figured out that it would be a good option for me to follow my dad's footsteps. So I ended up going to chiropractic school, and the rest is history from there. So I've been very blessed to have a very active patient population. It makes it easier on me, and obviously the reason why you guys are here is because you're active people. So you're part of a sports club, you like to move your body, and you want to continue to maintain moving your body. So these will be helpful things we'll go over today to help you to continue those things that you want to do and continue to be active as well. As we're going through the presentation, if you have questions, just go ahead and ask. We'll just answer questions throughout the presentation as opposed to holding off, because I think if you have a question that talks about, or a question about some of the topics we're talking about, it's better that we answer them there. That way it's fresh in everyone's mind. So we'll go ahead and get started here. Well, maybe. There we go. All right, so most of us can relate to this, right? This is kind of where we're going as humanity continues, right? So we obviously started as very active, people, species, right? We were, obviously gathering and hunting, and we were constantly on the move. We were constantly, keeping our body active throughout the day. As times continued, you can see that person on the far left there, or your right. That's kind of what our days look like nowadays, right? We sit for long periods of time. We become less active, and we allow our bodies to be just stuck in these static positions, right? We don't encourage blood flow to our body enough. And, a lot of what we're dealing with musculoskeletal-wise is because of some of those repetitive sitting positions there. So, this is a kind of a good picture just to show us kind of what we've become as humanity. So just a quick anatomy. The lumbar spine is made up of 5 different vertebral segments. In between each one of those vertebral segments, this is a pointer on it too. Oh, perfect.
It does.
In between each vertebral segment, so this is a vertebral body right here. It's the bony structure that creates support for the spine. But in between each one of those vertebral bodies is an intervertebral disc right there. So the disc is made up of a kind of a jelly substance on the inside, and the outside of it has a bunch of different, they're called annular fibers or annular rings that sit on the outside. So, you hear somebody saying, I have a disc bulge or a herniated disc. All that means is that jelly on the inside of the disc right here has started to herniate out and push out those outer fibers to create that herniation or disc bulge. So, like I said, 5 different segments make up the lumbar spine. These are bigger, vertebral bodies than elsewhere in the spine because they take on more stress of the body, right? So anytime we have a transition point between one part of the body to the next, a lot of those structures will be larger, they'll be thicker, right? So the lumbar spine transitions from lumbar spine to pelvis down into the hips there. So this area obviously takes on a huge load throughout the day when we continue to stress it with different movements we do. So this is an important concept to understand here, because if we throw off one of these segments here, right? So if we don't allow one segment to move as opposed to the other segment, it's going to create compensation. So ultimately our body is basically just a pattern of stability to mobility. So if you look at the foot here, right, the foot is in contact with the floor. It's a very stable surface. It doesn't allow for a whole lot of movement inside the foot. So if you think of the bottom of the foot outside of the toes, right, the bottom of the foot is a very stable part of your foot here. Your ankle is very mobile, right? You can move your ankle in 3 dimensions. You can move it dorsiflexion, flexion, which is up and down. You can move it in and out, right? So you can move it in multiple directions. Your knee is a very stable structure, right? You can only move your knee in flexion and extension here. Your hip is very mobile. You can move it in many different directions. Your lumbar spine is very stable. It does really well just in flexion and extension. It doesn't do so well in other movements. Your thoracic spine here, it's a very mobile part of your spine. You can move it in many directions. Your scapula sits right on the thoracic cage there, but that's a very stable segment. It doesn't like a whole lot of movement. Your shoulder, right? Obviously, you can move your shoulder quite a bit, right? You can move it in different motions. Your elbow, it only moves really well in this position here, right? If you try to take my elbow and try to move it this way, it doesn't work very well, right? Your wrist, very mobile. You can move it in multiple directions. Your hand, right? Palm of your hand right here. It's not very mobile. You can only move it in not many directions, but it's not very movable. So ultimately, like I said, if you throw off one of these patterns, so if you try to gain too much mobility in your lower back, an area that needs stability, it's going to create compensation elsewhere. So if you're trying to move too much from your lower back, you're most likely going to create too much stiffness in your thoracic spine to compensate for that. Or if you're trying to move too much in your lower back, you're going to create too much stiffness in your hip here because of the lack of stability from your lumbar spine. Okay, so another important concept to understand here is in our body we have local stabilizers, which are basically muscles that sit very close to the certain joints there. And we have global mobilizers, right? So what a global mobilizer would be is like the bigger muscles in our body. So think of like your deltoid. It's a muscle that sits more on the superficial of the joint right here, and it just helps move our arm, as opposed to like your rotator cuff muscles. Those are muscles that sit really deep in the shoulder. Those are muscles that help supply stability for that shoulder joint. So within our lower back, we have our latissimus dorsi, which is a big muscle that sits in the more superficial of our lower back. It doesn't supply a whole lot of support for the spine, but it helps with some generalized movement of the lower back, movement into the shoulder there too. We have these deeper muscles here. Now these are the muscles we need to understand to create stability for the spine. We have these deep muscles in the spine called our multifidi. We have our diaphragm here, which is a muscle that sits right underneath the lungs. You have your transverse abdominis, which is a core muscle that sits a little bit deeper underneath the rectus abdominis, which is like your six-pack muscle. You have your muscles of your pelvic floor. So these four muscles right here are the big muscles that supply stability for the lumbar spine. If we have good control of these muscles here, we have good control of our lumbar spine and of our pelvis here. So this is what we're going to be really focused in on trying to gain control of, is these four muscles in this area through here, right? Honestly, like these global mobilizers here, those are the ones that everyone wants to make big and bulky, right? Everyone wants to have a nice lat. Everyone wants to have nice deltoids, but they don't supply the support we need for those structures, right? Ultimately, it comes down to what muscles sit closest to that structure that we need to make sure we have good control of. I need to click on that.
She's going to take a picture. Oh, you will send? Oh, no, so no.
Okay, so like I said, once again, when we talk about our core, this is the area we're talking about, right? Ultimately, your core is kind of like the transmission in your car, right? So it doesn't necessarily supply energy. Your energy comes from lower body. Your core transmits energy from your lower body to your upper body, right? So it's kind of like the transmission. Your upper body transmits energy from your upper body to your lower body. So we need this here to transmit energy or movement from upper to lower, okay? So this is the area where if we're going to have good control of our body, if we're going to have strong, a strong lumbar spine, but overall, if we want to be, a healthy human being with regards to musculoskeletal, we need to make sure we have a strong core. So if you're looking at this picture, if I asked you which one of these has a strong core, which one of these would you say is supplying enough support for their spine to make sure it's stable? Most people would say, she looks pretty fit, right? She's probably got a strong core. How many would say this one over here? Yeah, strong core there. How many would say the baby here has a strong core? Okay, so this right here is the answer, right? And the reason is because what a baby does is when you're born, you're programmed to create control for your spine, right? You're programmed to make sure that you're using this area properly. That way you can develop from laying to rolling to crawling to sitting to standing, right? So what this child right here is doing is they're creating a whole lot of control down to the abdomen, right? You see this little like pot belly right here, right? You would never see a baby when they're breathing, you would never see a baby breathe up into their chest like this, right? You would never see them reduce core stability and breathe up into their chest. They're always going to have these little pot bellies, and as they breathe, they're creating intra-abdominal pressure, or they're creating pressure down through here to create stability for their spine. When you think of this picture here, right, like see how her ribs right here are flaring out like this, right? She's ultimately breathing up into here, and she's putting so much pressure up in her chest in here, so she's not gaining the pressure in her stomach, she's gaining too much stress on the muscles in her lower back. So when we think about core strength, we need to think about more of this right here. We need to think about more of gaining pressure down into the abdomen as opposed to sucking in and breathing up into our chest. I'll talk a lot more on the breathing aspect of it later because that's a huge portion of it. When we breathe properly, we engage all 4 parts of what I was talking about before: the diaphragm, the transverse abdominis, those multifidi muscle in the back there, and then the pelvic floor muscles down here. All 4 of those structures are being supported or being utilized when we're breathing down into our abdomen like this, right? But this doesn't look sexy, right? This looks, right? I mean, who wants to sit like that and breathe like that? Not a whole lot of people. So we'll talk a bit more on how we can gain control of this. What's that?
Joking, have a big belly.
Okay, so moving on from here, right? This is exactly what we just talked about in this picture. When you're looking at the core, right? When you're looking at stability for the lumbar spine, you can see what this picture looks like, right? If you took a water bottle here, right? If I had this water bottle half filled, or like maybe a little bit less than that, maybe a quarter filled, if I tried to smush it like this, right? Like I can get this water bottle to kind of push in. If I had a little bit more full here, I'm not going to be able to squeeze that water bottle because of the pressure from within it. Right? So if you think of this here, right? If you think of this picture here, you can see as we're allowing our diaphragm to push down, as we take a breath in and we're allowing our diaphragm to move down, we're gaining this pressure within the abdomen here. That pressure then applies stability for the whole core structure, right? So if you took a deep breath right now, if you tried to, it might be really hard for some people because you did it when you were, just born to like maybe 2 or 3 years old, and then we start sitting a lot, so we start breathing up into our chest. So it might be hard for you to learn it at first, but if you can really work on thinking of taking a deep breath and breathing more into your stomach here, you're going to feel that pressure engage around your spine, right? You're going to feel reduced tension in the muscles in your lower back here. So this is a huge concept to understand is the way we breathe and how it correlates to providing some form of stability for the lower back, right? And not breathing into our chest, not breathing and sucking our stomach in like this, right? We want to make sure we're breathing down into the abdomen. So here's a little video. We'll just click play down here. One more time. Okay, so in this exercise, we're going to cover intra-abdominal pressure and deep belly breathing. First thing we want to do here is we want to try to flatten our back out to the ground. So we're going to put our hand on the back. Really try to push your back in your hand there. We're also going to try to drop our ribs down too. So we want to get the core in a really good position here. In this position, we're going to take one hand, we're going to place it on our stomach. The other hand is going to be placed on our chest. All we're going to do here is we're going to take nice deep breaths into our stomach, trying to breathe down into like your belt line. From here, just nice, easy, deep breath. While you do this, you're going to feel a bunch of pressure build up throughout the abdomen here. We also don't want to see the chest raise up. If you're doing it wrong, it'll look like this. And so, like I said, if you don't feel any pressure in the stomach, you'll feel the chest raising, which is what we don't want to do. Once again, back flat, hand on the stomach, hand on the chest, nice deep breath into the belt line. So more movement here, right? You want to feel that pressure. You want to feel the abdomen expand as you take that deep breath in. once again, like I said, when we take those deep breaths in, we're allowing that diaphragm to drop down, right? We're allowing the diaphragm to move down because it has nowhere to go outside of the pelvic floor, right? So the pelvic floor is here, diaphragm is here. When that diaphragm drops down, you create all this internal pressure within your abdomen. So now those structures that are on the outside, right, those global mobilizers that I was talking about, those muscles don't have to work as hard because you're utilizing that internal pressure to stabilize the spine. You're using that pressure from within to give support to the system as opposed to utilizing those superficial muscles that are there for other locomotion movement, like moving your arm or movement of your hips there to work the way they should be working, right? You're utilizing the right way, the right function of that area. Okay, so now it's working. Okay, so a big topic like we like to talk about with regards to the lower back is posture, right? So people think that posture needs to be like military position when they're sitting or when they're standing, right? Fully erect, right? Nice and tall like this, right? Which is okay. This is something we talked about before, which is sitting position, right? We're stuck in that kind of slumped or rounded position. Not ideal for long periods of time, but once again, it's okay because your spine is able to move into that position. It's just like when we talked about is being there for long periods of time. So when we talk about posture, posture is relative because the best posture is always your next posture, right? So think of it this way, like if I were, instead of sitting, so think of it this way, if I were sitting and I was holding my arm like this for 8 hours a day, think of how irritated and painful my shoulder and elbow would be, right? If I'm not moving those structures there, I'm not getting blood flow to that area of my body, right? As opposed to if I'm sitting throughout the day and I'm moving my arms, I'm not feeling a whole lot because I'm gaining blood flow. I'm using those muscles there. So if we're sitting all day, if we're standing, a lot of people like to have stand-up desks now, right? But it's honestly just as bad standing in one position as it is sitting in one position because we're not gaining blood flow. We're not moving those muscles. So what I like to talk about with posture, or when people bring up the sitting versus standing topic or debate, I like to say let's do a little bit of both, right? Move your body. Go ahead and sit for a little while. Make sure when you're sitting you're not slumped. You're not slumped over in a rounded position for a long period of time. Make sure when you're standing, you put a little stool underneath your desk there and you're kind of moving your hips. You're putting one leg up at a time. You're gaining motion there because the more blood flow we get, the better off those structures are going to be. Anytime we increase blood flow, we're always going to create better function. We're always going to reduce stress on the area, okay? So with regards to activity and weightlifting, these are things that we do that repetitively stress these muscles. So once again, let's think of like somebody who sits all day, right? So a businessman or businesswoman, somebody who's sitting at a desk all day. From there, after they sit, they come to the sports club or they go to the golf course, right? They haven't been moving those structures throughout the day. They've been stuck in one position. Now all of a sudden you go to lift a weight, right? Or you go to swing a golf club and your back immediately fires up or you feel that twinge in your spine. It's just because of lack of movement, right? Your brain has lost control to that area. You've lost control. You've lost that mind-muscle connection to these muscles down here because you've been stuck in one position for so long. You've been breathing up into your chest. You've been reducing that intra-abdominal pressure. You haven't been getting what that part of the back needs. So when you put it in a stressful position, like swinging a golf club or lifting a heavy weight or bending over to put your sock or shoe on, right? All of a sudden, your brain has lost connection to that area, so it goes into a protection mode, right? That protection mode is spasm, tension, tightness, discomfort, right? That's basically an alarm to let your brain know that something's going on there. There's some kind of dysfunction that's causing irritation in that area. So like I said here, right, when we talk about posture, we talk about people who sit for long periods throughout the day, make sure you're moving your body, especially if you're doing something later on in the night, like lifting weights or going to play golf or going to play pickleball, something like that, right? Make sure you're keeping your body active throughout the day and you're not just stuck in one position.
Is the pain a muscle pain or is it a disc pain, when you do something like that?
Yeah, so most of the time it's just mechanical. So most of the time it is muscular pain. So it can be muscular, it can be ligament, it can be joint. Most of the time when we have kind of those isolated discomforts in the lower back, it's either one of those three. So it's mechanical pain. When we have pain that kind of radiates down to the leg or that sharp fire into the leg there, that numbness or tingling, that's usually more of a structural issue from like a disc or a nerve being irritated. So, like I said, when we get these discomforts here, usually it's because of lack of movement, lack of blood flow, loss of mind-muscle connection to that area, right? Again, another analogy would be like a pitcher that once again sits all day like this, and then you expect them to go out and throw 5 or 6 innings, right? It just wouldn't work that way, right? At some point, your arm or your elbow would be injured because of that, because you're not engaging good control of that body part.
Okay, so it's important that we find ways to move our spine throughout the day as opposed to just holding it in one position. Like most of us do, right? When we sit at a desk, we tend to just get stuck in one position. We hold that for way too long. If we can start moving the spine more often throughout the day, we're going to increase blood flow, which will help reduce tension, tightness. It'll get the joints moving. So you're gonna be bettering yourself just by simply doing some simple movements throughout the day. One easy thing you can do is just start by tilting your pelvis. So you can tilt your pelvis forward, and you can pull it right back. Tilt it forward, and pull it right back. All this is doing is just increasing movement. It's getting the muscles to work in the lower back. You're gaining more control of that area when you do this. You know, that way when you go to do activities after work or after school, whether it be working out, playing golf, playing a sport, those muscles are more prepared for that activity, and they're not stiff and tight from being stuck in one position all day long. So this is a really simple exercise to do, something you can do at your desk all day long. Just getting those muscles moving will really help the lower back.
So yeah, like I was saying, it's important that we find ways to move our body more throughout the day. So that's a very simple exercise. It's called a pelvic tilt, right? Just getting on the edge of your seat there, sitting nice and tall, and just allowing your pelvis to move anteriorly and posteriorly, right? Tilting forward and tilting back, and doing that, 5 to 10 times every hour, gaining more motion through there. Just like another analogy would be for the arm. If once again, if you held your arm in that one position, and then all of a sudden you went to pick up an object, right? If you weren't moving your arm throughout the day and you went to pick up an object, there could be injury there. So we usually don't have a lot of injuries in our arm, people who don't play sports like most of us at a professional level, because we're constantly using these muscles, right? We're constantly gaining good control. We're not just holding them in one position. So we can't talk about the lower back without talking about the hip, right? Because the hip is so closely related to the lower back. And if you remember back to what I was talking about, the pattern of stability to mobility, this is a very mobile structure, right? We have the ability to move our hip in a wide variety of motions there, which allows us to move in different positions, right? If we have a lot of tightness in our hips here, if we're not moving enough, so if we're people who sit throughout the day, right, and we don't move our hips enough, or we don't do lateral movement, we're gonna get a lot of tightness in the hips here, right? And that tightness in the hips is gonna contribute to tightness throughout the lower back as well too. So that pattern is so important. Maintaining good mobility in our hips will allow our lower back to be less tense, less tight, because we're utilizing the function of this joint the way we need to be utilizing it.
Maintaining good hip mobility is a great way to reduce tightness and pain in the lower back. These are 3 simple exercises to do on a daily basis to help increase hip mobility and reduce back tension.
So some of these are a little bit more difficult, all right? This one here is definitely something that's going to fire up some of those internal hip rotators around the hip there. But once again, providing good motion for that area is important to making sure that we have reduced stress in the lower back. This is an easy one right here. It's a good way to work the groin. It's a good way to gain better mobility in both hips, right? But this one's especially going to help gain mobility in the leg that's outstretched there. So even if it's just doing simple things like sitting in a chair and moving your foot side to side, like if you are sitting at your desk, right, you're working, and you're just kind of open up your hips and you just do some simple motion like in and out, right? You're just getting motion to that area through there. That's better than nothing, right? Because you're getting that joint to move as opposed to just being stuck like this all day, right? If this joint has the capability of moving just the same way our shoulder has the capability of moving it, but we're not moving in that direction, we're putting more stress on the lower back and the structures in the pelvis here.
How often do you recommend doing those types of stretches?
So like the sitting one, 5 times every hour if you're sitting. The hip one right there, add that 5 times every hour, right? Both sides, right? Just in and out, right? They're simple to do. It would take 30 seconds to a minute, but you're getting motion there. You're allowing your body to move.
Great question. Are we gonna get a copy of those exercises, or how can we access that data?
Yeah, so I think they're recording here, so you will have a recording of the.
Yep, and myself, I'm going to be sending out
Oh,
this
you are? Okay, that's
recording
good.
after the presentation.
Because the ones on the ground look good, but I'm
Yep.
not sure I remember what.
Yep.
We'll be sending those
All
out.
right, thanks.
Yep, definitely. And make sure, so, I post exercises on here, but go slow. Like if you go back and you watch these exercises, just go nice and slow through them. See how they feel. If it doesn't feel good, don't do it. Just because if you don't have, full guidance with somebody there, it can be, thrown off a little bit, but just, try to move slow through some of the exercises that we go through. So this next section here, we're going to go through a bunch of different exercises. So all exercises that are going to target, once again, those core areas, lower back, and glute muscles here, right? So another area I didn't talk about, which is the glute muscles here, right? The glute muscles are a large structure that sits in the pelvic region. These muscles are responsible for almost every movement we accomplish when we're walking or doing anything upright. So if you look at the back of the body here, right, the largest muscular structure on the back of the body would be our 3 glute muscles here, right? So if we're not utilizing these muscles, if we don't have good strength in these muscles here, it's going to put increased stress on the muscles in the lower back, increased stress on the muscles in the hamstrings. So a lot of people say, stretch your hamstrings if you have lower back pain, right? Honestly, it's not the best thing to do, right? And it's been something that a lot of people have given as an exercise or advice to help reduce lower back pain. The best thing you can do to reduce tightness in your hamstrings is to strengthen your glutes. Your hamstrings get tight as a protective mechanism because this isn't working hard enough here. So when your glutes start working harder, or when you have that good connection to your glute muscles, you reduce a lot of the tension and tightness you have in your hamstrings because they're not trying to protect so much because of weakness here, right? So if you have tight hamstring muscles, start working on your glutes. If you have lower back pain, start working on your glutes. You combine strengthening your glutes with good abdominal pressure or good belly breathing, you're setting yourself up for a very strong and stable core.
Okay, so the first exercise we're going to cover for the core is a simple dead bug exercise. In this position, we want to be laying on our back. First thing we want to do here is we want to try to flatten our back out. We want to drop the ribs down, just like we did with the breathing. All right, so this next exercise is a glute bridge. This is a very foundational exercise that we see quite often, but a lot of people tend to do it the wrong way. So what we're going to do is on your back, feet at shoulder width apart. We're going to bring our heels in tight towards our glutes there. From here, once again, we're going to flatten the back out, drop the ribs down, take a couple deep breaths into your.
Sorry, I think I missed one here. Let's start over. Here we go.
Okay, so the first exercise we're going to cover for the core is a simple dead bug exercise. In this position, we want to be laying on our back. First thing we want to do here is we want to try to flatten our back out. We want to drop the ribs down, just like we did with the breathing from here.
So like I talked about in that first video I showed where we were trying to create pressure within the abdomen by breathing, we're going to continue to do that through a lot of these exercises, is getting that back into a more flattened position and then trying to expand through the stomach here. So that's an important position for each one of these exercises we go through, is getting your back to get away from being in that arch position, flattening the back out, getting the ribs to drop down, and focusing on the breath work there too.
Our arms can come down here, arms can go up here, whatever you like. I'm going to start down here. We're going to bring the knees up to 90 degrees. It's extremely important that when you bring your knees up, you do not let your back come off the ground, right? It's going to be one of the goals for the core, is to keep the back flat to the ground. So when we do this, legs come up to 90 degrees, but back stays flat to the ground. In this position, before we start, we're going to take 5 deep breaths into our belt line, just like we did with the belly breathing.
So if you look here, right, look at how much expansion I have in my abdomen here, right? That expansion that I'm gaining from that breath, like if you went to punch me in the stomach right here, you would feel how solid it is because of that pressure that I'm getting from the breath there, right? Just like if anybody has a grandchild or a baby they're around, right? Like when you see them walking, you see this control they have and this stability they have in their stomach. That's something we're trying to recreate in some of these videos here, but also as we get older, because like I said, society has been so much, it's been so much emphasis on us having a small waist, right, and having a big chest, that we all end up just sucking our stomach in and breathing up into our chest, right? So over time, we just continue to load down on these lower back muscles because we're not getting that proper stabilization from the right ways we should be breathing.
Breathing nice and deep into the abdomen. From there, we're going to continue to create that pressure in our stomach, keep that intra-abdominal pressure. We're just going to take one foot down and bring it right back up. Same thing with the other one. Maintain that pressure in the stomach. Do not let your back come off the ground. If you need to make this easier, you can keep the leg bent. Okay, so we're going to do the same thing. We're just going to keep the leg bent. Nice and slow and controlled.
So like I said, the biggest part of that exercise is as you're taking your legs out, you're not letting your lower back arch off of the ground there. You're keeping your lower back nice and flat. Once again, I'm going to harp on a baby, right? If you lay a baby on a table or on the floor or whatever, you would never see them laying and have this little arch in their lower back, right? You would see their back nice and flat. You would see the muscle tone, throughout their upper chest and traps and neck to be very soft and relaxed, and you would see them just taking those nice, slow, deep breaths in their stomach there. So basically what I'm saying is do what a baby does.
So we have to breathe all the time like a baby?
Yeah, definitely. So even like when you're
So
sitting,
this next exercise is a glute bridge. This is
even when you're sitting at work or when you're sitting in your car, or, obviously when you get into an athletic event like running or any type of something that's going to stress the cardiovascular system, there's going to be more of a response to breath up top here, just because you're moving your body. It's more of like a fight or flight mode, so we just start to increase that breath up top. But the more that we can focus in on breathing better down into our abdomen, the more stable our spine's going to be. So whether it be sitting in your car or sitting at work, you're focusing on keeping your upper body nice and soft, nice and relaxed, and just taking those nice, slow, deep breaths down into the stomach there. Okay?
just a very foundational exercise that we see quite often, but a lot of people tend to do it the wrong way. So what we're going to do is on your back, feet at shoulder width apart. We're going to bring our heels in tight towards our glutes there. And here, once again, we're going to flatten the back out, drop the ribs down, take a couple deep breaths into your stomach or your belt line. From there, arms go down the sides there. What we want to do first is we're going to try to engage the glutes. So we're going to squeeze the muscles in our glutes there. We're going to try to get our brain to have that mind-muscle connection to the glute muscles. From there, we're not going to use our hamstrings. We're going to try to keep these muscles as least tense as we can. We're going to drive our feet into the ground. We're going to continue to squeeze the glutes. We don't have to go very high with this. So, I'm just going up to here, but I'm feeling my glutes contract.
So a lot of people have seen a glute bridge exercise, right? It's a common exercise done in the gym, done in Pilates, whatever it may be. This exercise is wrecked by a lot of people, right? A lot of people try to move too quick through this exercise, but the glute bridge is a really good exercise to isolate into your glute muscles. A lot of people, what they'll do is they'll engage too much in their hamstrings, or they'll overarch in their lower back, and they'll gain too much stress in their lower back. So the exercise will be nulled because they're not even using what should be engaging there. So in this exercise, like I said, again, biggest part here is getting your back nice and flat, getting that pressure in your abdomen, and then getting your brain to connect into those glute muscles there. So getting a nice little pre-squeeze of those glute muscles, getting your brain to have that mind-muscle connection to connect from your brain to the glute muscles and engage those muscles as you're lifting up. A good cue for this is if you were to lay like 1,000 pounds across my belt line there, the only way I'd be able to lift that weight up towards the ceiling is by engaging these muscles here. So if you think of something laying across my waist here, how am I going to push that up towards the ceiling? It's got to be through my glute muscles, right? I drive my feet down through the floor. I get good ground contact through my feet, pushing down here, and then I squeeze here, and I'm pushing up there, right? So a very functional exercise, a very basic exercise, but a really good way to engage the core and also get your brain to engage better into the glute muscles there.
Feeling those muscles working in this position. We're going to relax on the way down. We're going to re-flatten the back. Take a deep breath in, squeeze the glutes, drive the feet into the ground, and go straight up towards the ceiling. All right, so this next exercise is a glute bridge. Okay, so the next exercise we're going to go over is a isolated cat-cow for the lower back. We kind of did this when I showed the exercise sitting in a chair. We're just going to be a little bit more isolated to that lower back region now. All we're going to do is go into a quadruped position, so hands and knees here. All right, knees at hip width, hands at shoulder width. From here, we're going to try to tuck our chin back as far as we can. We're going to lift our thoracic spine, so the middle of your back, we're going to lift it up towards the ceiling. We're going to lock those two places in. We're not going to move those two places.
So it looks a little odd because the video is compressed this way, but when, just because everything looks kind of weird like that. But like I said, in this position here, on all fours, we want to make sure our head isn't leaking forward, right? Gravity is pushing down on us this way, so it's easy for a lot of us in this position here to let our head be out in this position like this, right? We get stuck here and we're putting so much stress and tension up through the posterior part of our cervical spine. We need to make sure as we're in this quadruped position, we allow our chin to be retracted back. That way we're not putting that stress up through here. Also, when you're in this position, we want to make sure that we're pushing our upper back towards the ceiling to lock out the scapula, right? To get the scapula in a good position, engage the muscles around the thoracic spine, engage the muscles around the shoulder here. In this position, we're not going to move anything from here up. We're going to keep it very stable, very controlled. The only movement is going to come from here. Like I said, the better we can control movement in one area, the more mind-muscle control we have. The more mind-muscle control we have to one area, the more resilient that area becomes, right? So it allows us to do more without going into that protective mode, right? So think of your elbow, how much we move our elbow throughout the day. If I want to pick up something extremely heavy in an awkward position, my elbow or muscles around my elbow wouldn't be affected because we constantly are moving our elbow. So our brain knows how to control movement in this area.
Hip our pelvis down and pull it right back up. We want to do this without moving anything else in our spine. Okay, so we're not doing a full cat-cow where you'd see people move their whole spine. We're just trying to move that lower back region. Once again, we're trying to just gain control of that lower back and help get those muscles working the way they should be.
So like I said, mind-muscle connection to that area, it's key, right? If we gain good mind-muscle connection, we have more resiliency.
That exercise we're going to do is called a low oblique sit. All right.
So this one is going to be a little bit more
position is
advanced, okay? So this is an extremely good exercise. It's something you would see like a 4-month-old baby do, but as we get taller, it becomes harder because our center of gravity has become more expansive. So in a baby, they're able to do these movements with more ease because their center of gravity is this as opposed to this, right? So this is a really good exercise. I wouldn't say start with this exercise. I would say definitely build into this exercise over time.
on our side here. The bottom leg is going to be at about 45 degrees. This arm is going to be, shoulder or elbow can be right underneath your shoulder here. The hand can be up here. This back leg can be here. We want to start once again by taking nice deep breaths with our stomach, trying to breathe down into that belt line. From here, this arm can come up. We're going to slowly roll into that bottom hip. You're going to apply pressure into that bottom leg. You can keep the back foot on the ground, and we're just going to come up and back down.
So like I said, this is more advanced, but if you think about a baby that's learning how to roll from their back to all fours, this is exactly what they're doing here, right? They're utilizing good core strength, they're utilizing lower glute strength, they're utilizing upper shoulder strength, right? All these muscles are coming into play to get them from a laying position on their back to their side to all fours. So ultimately, this is just a rolling pattern, right? But it's a very focused and detailed rolling pattern with emphasis on engaging proper core muscles around the pelvis, lower back, and then up into the shoulder there as well.
Almost simulating like a rolling sensation. You're going to feel this in the bottom hip. You can feel it in the lateral part of your hip here. You might also feel some in the oblique here. Breathe into the stomach.
Okay, so that's my presentation. If anybody has any questions, we'll go ahead and take them now.
That previous stretch where you're on all fours, the cat stretch, people call it. But I thought you were supposed to like raise your lower back high like a cat.
So once again, think of the positions that we repetitively put ourselves in. Like when you're sitting there, do you feel like you're rounding your back out when you're sitting? Right? Like as you're sitting here in this position, would you say your back is a little bit more rounded there?
Right now I am.
Yeah. So that's a position that maybe you hold for a long period of time when you're sitting at a desk or sitting in your car. So when we're doing that cat-cow position or that pelvic tilt position, I don't like to tell people to go into that position where they tuck their pelvis under and round through their lower back because we do it so much already. So I'd rather you go from a neutral position down into extension, like you're getting your pelvis to move down this way here as opposed to moving it this way here. Does that make sense? Because we always have our spine in this position here, right? When we sit, when we slouch like this, right, you can see my spine is already in that rounded position here. So if I'm doing that day in and day out, if I'm constantly putting my spine in this position, I don't necessarily want to continue to stress it from here to here even more. I'd rather go from neutral here down into extension, right? The reason being because your spine has the capability to move into that extended position. We just don't move it there enough, right? It'd be like, and I keep using the elbow as an analogy, it'd be like you doing this all day long, right? And never doing this here, right? This joint has the capability to move into extension and flexion, just like our spine has the capability to move into flexion and extension. But how often throughout the day do you move your spine into extension like this? Not very often, right? We constantly put our spine into flexion, and we repetitively put it into flexion, so we don't gain that motion of extension enough. All right, but when we have that motion of extension, we create better balance in the spine there. So that's why I only like, when you're doing those pelvic tilts, to go from neutral and to extension on all fours. Yeah. Yeah.
So if you have a herniated disc already, do these exercises help alleviate that? Or is it more for strengthening the core for muscular pain?
Definitely alleviate it, right? So it depends on your symptoms, right? If you have a herniated disc that is, or a bulging disc that is symptomatic, right? Because if we MRI'd 100 people, 80 people would come back with some form of bulging disc, arthritic changes, degenerative disc disease, right? That's just something we see, right? Because we stress that area so much that we're going to see something on an MRI. So a lot of people will come in and be like, I have a herniated disc at L4, L5, but my symptoms are just localized to the lower back. Well, that's just more mechanical lower back pain. There can be some types of like discogenic pain that come from the disc, but most of the time when we have disc pain, it's radiating down to the leg there. So with disc-related injuries or with MRI that might show some disc pathology, these exercises are perfect for it. One, because you're gaining more movement, you're gaining blood flow, but two, because you're stabilizing that area. The reason why the disc herniated is because you've got lack of stability in that area, right? So that area was moving too much in one direction. So usually when discs herniate, it's because we repetitively are in these positions here. A disc is like, if you think of like a donut, if I put a donut here and I pushed on the front of the donut, the jelly would shoot out the back, right? So think of the disc that same way. If you can go back to the anatomy slide. Keep going. It's like all the way to the very beginning. One more. There we go. So if you look at the spine right here, right, think of this as the top of the donut, that's the bottom of the donut, and that's the jelly in the middle. If I compress the front of the spine here, like we do when we sit, like this, right, this is compressing my spine. Where is that jelly? The only place it has to go is back this way. In between each one of these this is called a foramina here, in between each one of those foramina is a nerve that comes out and goes down into your leg. So when that disc herniates, it pushes up against that nerve, that starts to create inflammation in that area, and that's what causes pain down to the leg. So the reason why that disc herniated was because of too much movement into this position, or lack of control, or lack of stability, and it got to the point where it couldn't handle that repetitive stress, and it just started to break down these fibers, and that's when it herniated this way. So usually that happens, like people will say, I bent over to pick up an object, and all of a sudden I had this zinger down my leg. It's because of maximal stress in one area. So maximal stress on the spine, inflection, and then it just caused that disc to push back too far. And that's when we start to feel that pain there. But if we can control movement in the spine, right? If we can control that pressure around the spine. So if we go to this slide here, right? When you breathe into your stomach, you're gaining all this pressure here, right? So pressure here equals stability for this here, right? When you take a deep breath in, all that pressure is engaging in through here. So now you're reducing stress on the superficial muscles here, and you're gaining more stability of this whole area through there. Does that make sense?
Yeah.
So when you're breathing, you really have to push out? Like-
No, it's not a push out. It's just a very slow, controlled motion, right? So think of like, you would never see a baby breathe like that, right? So think of just taking a nice, slow, deep breath and allowing that breath to work down into your abdomen. So when you breathe, it should feel like if you place your hands, so the lower part of your rib cage right here, right? If you place your hands just underneath that and you gave yourself a little pressure, when you breathe, you should feel those hands expand apart, right? You should not feel this. See where my hands come in like this, right? This is not stability. This is not stable. This right here is stable, right? I can feel pressure here. That's what we're looking for. That's the stability we need for the spine, and that's the pressure we need within the abdomen there. Okay? Yeah, there you go. You got it. See, it's difficult to think of at first, but once you get it and you continue to do it, it's going to be a habit you have to just retrain. Because you've done it before. You did it when you were born and when you were probably up to about 2 or 3 years old, maybe longer, because, you know, kids didn't sit as much back in the day, right, as we do now, right? Kids go automatically into sitting when they go to preschool at 3 years old, right? They just sit there all day. So yeah. Any other questions?
When sitting on a bench or a stool, would you sit up straight and then do your...
Yeah, sit up straight and do your pelvic tilts. It doesn't have to be the whole time, right? Because our spine has that capability, and the more you move it, the better it'll be. But if you're sitting there and you're in a position like this for 10 to 20 minutes, and you think, oh man, I just got to move my spine, I got to engage some motion there, that's all you have to do, right? Just like I said, like you wouldn't be sitting at that bench with your arm like this. If you were, at some point you'd be like, oh shit, I got to move my arm a little bit, you know? So it's just all about controlling more motion in those static positions, right? So if you're in a static position, find a way to create motion in that position there.
Quick question on the breathing. If you're doing sort of like this yoga breathing, you sort of take something at the top, but then you have to push it down to the bottom.
Yeah.
Is that what you're looking for, or no movement whatsoever in the top?
I would rather have no movement up in the chest here. I'd rather have more of the breath come down into the abdomen and more down into the pelvis region there.
Right. Now, do you have any, I mean, you showed us lying on the back, you know, put your hands on your belly. Is there any other exercise you can use to try to condition yourself to do that? Because it's tough. I mean, it's easier.
Yeah, so what you can do
It's easier to do that than it is to...
100%. It's easier to do that because you've trained yourself for so many years to do it like that.
Right.
And on top of that, stress, right? Stress of life, right? We allow ourselves to just creep up through here, right? The more stress we have in our life, the more our shoulders get tight, and the more we just allow our body to be in like a fight or flight mode. That fight or flight mode produces more breath up through here because we're just constantly stuck in that, it's called a sympathetic position. So another good way to try to recreate that breath in the abdomen is getting into like a child's pose. So getting into a child's pose position, so if you go into all fours and you sit your butt back into that child's pose position, you can feel your stomach against your legs. So you can use your legs as a reinforcement to feel that breath down into the abdomen there, okay? So I know it might be hard to visualize. I mean, I can do it if you want me to do it here.
on the table and do it.
You want to see it? Okay. Yeah?
Not for real.
So yeah, I mean, going into like a child's pose position.
Ask me because I'll say yes.
So going into a child's pose position, getting back here, sitting here, and then from here you can feel that pressure engage down into your upper thigh because you can feel your stomach expanding, right? So it's another good way to use reinforcement of how you're feeling your breath. So you get here, stay controlled with your spine, stay nice and locked in up top, and then taking those slow, deep breaths in the stomach there. Okay, it's just another easy way to create that reinforcement.
Thanks.
Yeah.
That was spectacular.
Should be good at it. I mean, if I wasn't good at it, we'd have an issue. Any other questions?
The last exercise, the one that you said that was more challenging, where is it that you were making like the most, like the muscle that you're moving more?
So
This one or the this one?
So the movement comes from your hip and glute muscle there. As you go ahead and lift up in that position, the movement comes from the hip and glute. But then as you get into that position and as you're there, you'll feel more contraction or more muscle engagement of the core muscles, right? But as you're there, it's important that you stay focused on those deep breaths in the stomach, right? And you don't let yourself get up into your chest as you're doing it, because then you're reducing that stability around the spine.
Oh my God, okay, I'll try.
Yeah, that's a tough one. That's something we use with our high-level athletes, but it's a really, really good exercise. It's a really good progression. Anybody else? Anybody online there?
If anybody on the WebEx has any questions, you can use the chat box.
It's a very good presentation.
Thank you. I hope it sometimes it can get a little difficult when you talk about like the breathing and the anatomy around it, but I hope it made sense. One of the biggest things, like I said, to understand about the body is the alternating pattern of stability to mobility. If you want to maintain good function, make sure those joints that need to be mobile are mobile and the joints that need to be stable are stable. It's as easy as that, right? So making sure, like if anybody's a golfer here, I play a lot of golf, so people who sit at a desk are stuck like this all day, so they're not getting any movement out of their upper back here. That's a very mobile part of our body, right? If we don't have good mobility in that part of our spine, those people that play golf are not going to be able to get here because they're not going to be able to rotate. So now they're going to take from their lower back, right? So that just equals out to an injury. Like I said, if we throw off that pattern, basically you're setting yourself up for an injury. So mobility is super important in shoulders, wrists, hips, and ankles. Stability is super important in knees, lower back, scapula thoracic. So this joint right through here has to be very stable. And then your elbow, obviously. So like, think of so I'm in baseball a lot as well too. So think of a pitcher, right? UCL injuries here, they happen because of overstress on the elbow from being in a position where their elbow is constantly like this. So they're trying to apply too much mobility to a structure that only is able to do something stable. Does that make sense? So this joint is trying to do way too much, and that's when that ligament tears there. So if you can understand that concept, you'll literally create better function in your body because you'll know what each joint is supposed to accomplish.